Craig Mohnacky.
Okay, what's your position?
I'm CEO and veterinarian at Mohnacky Animal Hospitals.
In your hospitals, how long has it been since you've actually worked on animals and things like that?
I've not seen animals or done surgery probably for about 10 years now.
Were you a surgeon?
I did general medicine, yeah. General medicine and surgery and dentistry.
Let me start with a little background on Dr. George. How do you say his last name?
His name is Dr. Djordjevich.
Dr. George. How long has he been with you?
Oh gosh, I'm going to guess probably 22 plus years.
22
Yeah,
years.
yeah.
Okay. All right. Well, what's your reaction, your response to some of the allegations in this lawsuit brought by Stephanie Spears?
Sure. So our patient came to Dr. Djordjevich for a second opinion. The dog was diagnosed by the referring veterinarian with hip dysplasia. Hip dysplasia is a congenital problem. It's something that dogs are born with, and it presents in many different manifestations. When dogs are very young with the disease, it offers a very more grave prognosis. Commonly, it's a later onset illness, but when it's presented at a very young age, it's problematic, more problematic. So the patient was diagnosed from the referring veterinarian with hip dysplasia. Dr. George did the interpretation of the radiographs. I believe under sedation, he physically did an examination, and he concurred with the referring veterinarian that indeed the dog did have hip dysplasia, which at a young age, I believe the patient was probably, from my recollection, maybe around 10 months of age.
Right, that's what they said.
Yeah, and so at a young age with hip dysplasia, it offers a very difficult prognosis because there's not a lot of great options for the patient. However, when dogs are young, there are some procedures that can delay the onset of degenerative joint disease, which is the arthritis that develops because of the hip dysplasia. So Dr. Djordjevich, we refer to him as Dr. George, evaluated the patient and discussed the options with the client. And really the options are very limited for a young dog like that. And when a dog is really relegated to management with medicine and pain medicines and or total hip replacement, which is a more aggressive procedure. But ultimately, some dogs, that really is the only option for the patient is to do a total hip replacement.
For people who don't know what hip dysplasia is, can you,
Sure.
in layman's terms, describe what it is and whether it's curable and what it
Good.
goes to?
Yeah, so hip dysplasia is a deformity of the hip joint. And what it is by definition is a abnormal laxity or looseness in the hip joint. And when you have a ball and socket that works like this and it's working like this instead, you get a lot of different activity in that hip, which ultimately leads to a degenerative disease. And that's ultimately what causes pain and ultimately why many dogs have to be put to sleep because of that condition.
Well, when the dog's 10 months old like this, is this common, or do you see this a lot?
I've seen dogs at 6 months of age that had to be put to sleep because they cannot walk. And so the degree of hip dysplasia is it's varied, but it could be that severe where there is no treatment.
So what did Dr. George end up doing in this case? What kind of surgery?
Sure. So there's a couple of different procedures that can be offered, but he did a procedure that the goal of the procedure is to delay the onset of the degenerative joint disease, because what the surgery does, it actually doesn't do surgery on the hip. The hip isn't impacted at all. It does surgery on the pelvis, which allows the pelvis to rotate and cause a more normal hip joint. It changes the conformation of that hip joint, so with the goal and the effort to delay the onset of joint disease as the dog gets older.
Well, so one of the allegations in the lawsuit is that Stephanie Spears says that she was told by a technician that Dr. George was a board-certified orthopedic surgeon. What's your reaction to that?
We've seen that allegation. From my interviews and discussions with all parties involved, there is no indication that anybody has suggested that.
Okay, so you're denying that.
Oh, absolutely.
Is
Yeah.
Dr. George a board-certified orthopedic surgeon?
He is not.
Okay.
So to continue with the discussion of the surgery, there is a post-op evaluation at 6 months, or at 6 weeks, we radiograph the hips. At 12 weeks, we radiographed the hips, and the surgery went well. The patient did perfect. The surgery was uneventful, and I would say in all indication that the dog benefited from the surgery, because it's something that can't be measured because you don't have a control. But what the surgery was to do is to make that conformation of that hip better, to delay the onset of more serious degenerative joint disease. So Dr. George did the 2 follow-ups, 2 x-rays. Dog did perfect. The surgery went well. And we did not hear back from Mrs. Spears, or Dr. George didn't hear back from the client just didn't hear back. The next contact that I recall having with the client was a discussion she wanted to have with me and or my staff about us paying for future surgeries for the dog. And we inquired as to what was the rationale for her asking us to do surgeries that the dog not only didn't have yet, but we're going to have in the future. And she claimed that what we did caused the dog's problem, the congenital illness or the congenital problem. So she equated Dr. George's surgery, which is a palliative surgery to help the dog, to the fact that Dr. George's surgery now caused my dog's congenital problems. So she made that assertion. And
well, when you say congenital problems, what do you mean by
you're born with it. You're born with them. Okay. Yeah, a congenital is you're born with it.
She told me that the dog seemed to be in pain over several years. She tried to get follow-up appointments, and that the dog was just limping, seemed to be in pain, and
certainly consistent with hip dysplasia.
Okay.
Yeah.
And then when she ended up getting a second opinion, that doctor told her, well, no, he needs knee surgery.
Okay.
And that the hip surgery should not have been done on a dog who was more than 6 months old.
Okay.
What do you have to say to that?
That procedure is done commonly between 6 and 12 months of age. I mean, that's commonly what we recommend. It's a normal recommendation. I believe at the point of that suggestion, and that's the suggestion that is made by the client, I believe I asked her, or maybe I believe I asked her, somebody had asked her, can you please have that surgeon connect with us that told you that? Or have him in writing explain the procedure, or that we did something wrong, or that something didn't make sense. And she never could come up with a document or a call that indeed that was the case, because no prudent veterinarian would look at the procedure that was done and say something like that.
So what you're saying is these two, the hip problem the dog had, and the later, maybe, over the course of 3 years, the knee problems that the dog was having are unrelated. And
to that surgery, absolutely. The surgery that was done originally had nothing to do with the knees, nothing to do but help the conformation of the hips. And the surgery went beautifully. There were no complications. Everything healed properly. We took post-op x-rays and everything went great. But when she came back to us, she wanted money. And she made these allegations that Dr. George's surgery caused my dog's problems now and into the future. And that's false. Unequivocally false. So when the client pushed the matter, and I first suggested, please have a peer bring in information and help us understand that how this caused the problem, or a dog's current problem, or will cause future problems. And nothing could be produced, nothing could be brought to our attention. And then she became a little more, a little more demanding, and I said, you know, if you really feel this way and you're going to pursue a legal thing, I usually will refer this to my insurance company, and because I can't help you anymore beyond what I just tried to help you with, try to help you understand.
Did Dr. George offer to do the knee surgery later for free as kind of a way of settling this?
I have no idea. I don't know that fact, if that's a fact or not. I'd have to ask Dr. George. But trust me, at Mohnacky Animal Hospitals, we do anything we can to help people in need. And it wouldn't be surprising if Dr. George would lend himself to help this woman, because this is what he does.
Why isn't Dr. George talking to us?
Because I am the owner of the hospital, and I think that this is the most appropriate fashion to represent our hospital. Now, Dr. George, he is a very talented person. His surgery capabilities are advanced because of his advanced training. He did lots of work with CE. He took courses. He's just taken lots of effort to learn how to advance his surgical techniques. He also participates in doing total hip replacements. He does that on a regular basis. He's done total hip replacements where he's actually pioneered the hardware and the techniques for these hip surgeries. And so he's very accomplished, and he loves what he does. So he becomes a huge resource for all of our doctors.
Well, if he's not a board certified, why is he doing orthopedic surgery if he's not a board certified orthopedic surgeon?
He's not a board certified orthopedic surgeon, but general practitioners do orthopedic all the time. I did orthopedic surgery when I was practicing. We all do. If you choose to do orthopedic surgery, you can do orthopedic surgery. You're not precluded from doing ocular surgery. You're not precluded to do dermatology workups because you're not a dermatologist, board certified. We all are generalists, that we choose our interests. And if our interest is doing orthopedic surgery, there's a plethora of continuing education that is promoted through our industry. So, yeah, that's Dr. George just loves what he does, and he loves to mentor all of our doctors.
If one of your staff said that he was a board certified surgeon, made that assertion, that would be wrong on the part of the...
Absolutely.
That would be fraudulent if that happened, right?
Yes, and it would be, yes, it would be against the conduct of a veterinarian.
What if I told you I have a couple old former employees who said that those assertions were made and that there was a effort to encourage orthopedic surgeries, they allege, to make money?
Sure. I would be very shocked and surprised that that was the case, because from my understanding and the people that I talked to, there was no indication. And these are people that were very much intimate with the orthopedic environment. So you'd have to, under deposition, learn more about these allegations, because all it is hearsay, and that's it.
Right.
So
that
means
they are former employees making these statements.
Yeah, that
more than one.
Yeah.
How do you respond to that?
I have no response, because it's just hearsay. There is no way to respond to that.
Okay.
It wouldn't happen. It wouldn't happen under my watch or Dr. George's watch. Let's put it that way.
These kind of assertions.
Yeah, it would have never happened on our watch. Exactly.
Or pushing patients to have
orthopedic
surgery.
No, that would be totally beyond our values that we have at Mohnacky Animal Hospitals. Absolutely.
All right, very good.
Yeah, there'd be no reason. There would be no motivation.
Well, they allege a monetary motivation.
There is, yeah, but there's no motivation.
There's big money in these kind of surgeries, right?
It's money is never, to me and to Dr. George and to my career, money was never the object. Matter of fact, when I went into this industry, I came into this industry for 4 reasons. And it was no other reason than I love people, I love building relationships, I love creating a sense of community with my team. My wife and I, when we moved to California, we had no family out here. We both were from Ohio. We were a transplant from Ohio. And my sense of community was keen, and so my employees, my staff, they became community. So we create a real keen sense of community at Mohnacky Animal Hospitals.
All right, well, can we talk about these other lawsuits? There's
Sure.
additional lawsuits, small claims and in civil court, where there were some allegations involving Dr. George or other doctors. Generally, what do you have to say about these other lawsuits? Some of
Sure.
them that were settled, and some of them that resulted in judgments against you.
The comment I'll make is this. I employ right now 9 doctors and 75 employees. I've practiced for 44 years. Over those 44 years, if I said I employed 100 doctors, I probably would be very conservative to say that. I would say I've employed hundreds of employees, maybe thousands, over the 44 years. And not once in that period of time has there ever been a board complaint that resulted in a citation or violation of the Veterinary Medical Act. Never. So that in itself should speak volumes. There are isolated cases. There's fee disputes, there's landlord-tenant issues, there's employment issues that arise when you employ thousands of people. Anybody that's in their own business, small business, will understand what litigious society we live in, and lawsuits happen all the time for no reason at all, just because they can. So for me to comment on confidentiality and other people involved, but if you look at the numbers, gosh, it's a paltry number in terms of the exposure and what we have done for the community and for our clients.
Some of these old cases involve a dog that came in to be spay or neutered, and the intestines of the animal ended up being expelled from the body.
Yeah, so cases like that, it's not. I'm not involved. The doctors.
Puppies that were brought in and died of heat stroke, wrongful death of an animal, dental surgery where the teeth weren't actually removed, instead they were ground down. I mean, those are legal actions that you're aware of, right?
Right.
I'm not asking you to comment on the specifics, but you're aware these aren't employee actions and tenant-landlord disputes. These are related to medical issues
and if
with
you
these
look
hospitals.
and if you look at these, most of them would boil down to fee issues, the cost. It all boils down to that, and
it all boils down to money.
Yeah, typically so. But my point is that we have a huge exposure. We have so many people doing so many things, and when you look at the numbers, and after 44 years, there's going to be issues. You're going to have issues. Medicine, human medicine, is the same way. There's no guarantees.
So you're saying this is normal in the course of
No, it's not normal, and we never want anything to happen out of the ordinary, but life and veterinary medicine and things happen. There's not a hospital, there's not a doctor that doesn't do a surgery and something happened to a patient, maybe even death from anesthesia. Things happen, but these are isolated instances that have nothing to do with the allegations that are brought forth to us by our client. They have nothing to do, and I would rather not. I would not like to refer to them because they're not I'm not involved with these cases, and they're not something that I even would like to comment on.
Right, I understand, but they are your hospitals.
They are my hospital. Hence,
Dr. George-
hence, that's why I'm here with you today.
I understand.
That's why I'm here with you today.
So is Dr. George a part owner of the hospital?
He is part owner, yes.
Okay. What do you think Stephanie Spears' motivation is?
Okay, so I didn't totally finish my story about Dr. George's follow-up with the original surgery. So the original surgery was done, everything was fine. We didn't see back from the client until she came to us asking for money. Okay? I worked with her, I tried to do the best, and maybe Dr. George even reached out. I don't know, I don't know the specifics of that. But when she came to the point where I just could not help this lady anymore, I had to ask my insurance company, because the insurance companies always ask you, don't let something go on for a long time, at least report it to us. This is where the problem lies, because until she realized, number one, three things happened. Dr. Mohnacky wasn't going to give her money just because she wanted money, because we did nothing wrong. Number two, the Veterinary Medical Board didn't have any option for her because there was no egregious error that was made. There was no malpractice. There was nothing involved. So the Veterinary Medical Board was not going to do anything. Matter of fact, she is so upset at the Veterinary Medical Board that she claims she has a friend that works for the Veterinary Medical Board, and she told the client that unless a doctor kills 100 dogs, they don't care about you. They'll just let things slide. And that was put in a social media post.
What's your general reaction to some of these posts?
Well, the reaction is that they're unilateral efforts to disparage Mohnacky Animal Hospitals. Because the clients that know me, they're like confused. Like, this makes no sense. This isn't Dr. Mohnacky. I've been going to him for 30 years. This isn't what Dr. Mohnacky does. And so I lended myself to my community of clients, to the community in general. And if there was any question as to my integrity or our integrity in the situation, I want to be able to talk to you about it.
Do you think the fact that you're not feet on the ground in the hospitals doing operations anymore, that possibly this kind of behavior by Dr. George is flying under the radar and you don't know about it?
Absolutely not.
Why not?
Absolutely not. Because I have a connection with my doctors that I would know anything like that. I mean, it just wouldn't go unnoticed. It just couldn't happen.
Ms. Spears, her husband is a Marine, a disabled Marine. They were hoping for this animal to be a service animal, and they claim the surgeries are to blame for the dog basically being lame,
right,
limping, and the dog can no longer be a service animal.
Sure.
That's a very sympathetic story.
Absolutely. My heart goes out to him.
And so that's why I'm asking you if there's some way to resolve this, you know?
Yeah. No, I mean, I'd be all for a resolution, and matter of fact, I'd be more than happy to have any kind of dialogue with my insurance people and try to see if they can nudge it a little bit. But my point is, when you acquire a dog for service, the first thing you do is you go through elbows, hips, eyes, and you evaluate for congenital problems. A dog in this condition presenting on day one at an early age is not an animal that would be chosen for a service dog.
Well, you bring that up now I'm reminded that she claims that it wasn't a congenital issue, that the dog was injured when it jumped out of a car, and that's when she first brought it. The
dog was diagnosed with hip dysplasia by a referring veterinarian, Dr. George conferred. The x-rays, from my understanding, it's so obvious, you don't even have to be a well-trained person to see that the hips are not in the right formation.
So this
jumping out.
The injury could not have been caused by jumping out of a car.
What injury?
The injury to the dog. The reason why she first brought the animal in was because she claims it jumped out of a car, yelped,
right,
and seemed to be in pain. So that's why she brought it to the hospital.
Yeah, so no, I mean, I can't comment on that other than the fact that the dog was diagnosed with the problem, and we did our best to try to help the dog in a short and midterm.
A problem it was born with,
It was born with, yeah.
not the result of the injury.
No, absolutely not. No, no.
Okay.
Yeah.
Anything else you wanted to
Yeah.
say?
No, no, and again, I pray that, you know, my heart goes out to the family. I know they've been through a lot, and it's been very stressful and demanding. But we only could do what we can do. We can only help them the best we can. And I would be more than happy to come up, try to find a resolution. But this is not how you go about it.